Hi, everyone. I'm Jay Watson with Emory Brain Health, and I'm joined today by Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Welcome once again, Dr. Del Rio. Good to see you this week.
Happy to be with you.
Why don't we start off with something very obvious and important, which is how quickly things change week to week. So since we talked a week ago, what has happened and what are the big things in your mind that we need to cover before we get to our questions?
Well, a lot of things have happened. First of all, we have a lot of big numbers, right? Big numbers. The world passed 3 million confirmed infections. The U.S. passed 1 million confirmed infections. We have now over 70,000 deaths in the U.S. The number of deaths in the U.S. nowadays is the equivalent of about one 9/11 number of deaths on a daily basis. And I think people need to understand that if we thought that 9/11 was a lot of people death, would think about 9/11 happening every day. And that to me is incredibly sad and incredibly concerning. We also have some good news. And the good news is, as you know, preliminary data were released on a very well-conducted study in which we at Emory University participated with the drug remdesivir that was sponsored by the National Institute of Health. And in the Data Safety Monitoring Board, it became clear that people who received the medication had a faster recovery time. The number of days that they didn't not need oxygen was reduced from 15 to 11. And the death rate, the mortality rate, was also decreased from 11% to 8%. And based on these findings, the US FDA last Friday approved the drug remdesivir for what's called emergency use authorization. So it's not an FDA approval, it's simply the FDA saying, because of this good news, we're allowing it to use in certain circumstances, primarily people who are sick and in the intensive care unit. But I think we're beginning to see, as I told people, the door has cracked open to trying to find a treatment for this infection, and that's very good news.
It is good news. Okay, so starting off with our questions, we got dozens before we even started our live, and we'll start with those and then take them as they come in. Where does Georgia stand with testing right now, both for the virus as well as the antibody test? And what is the accuracy of these available tests?
Well, there's a lot of questions there. Let's start by the testing for the disease, the virus. And a lot has been expanded in Georgia as far as testing is done. The Department of Public Health, the National Guard has taken over testing, and there's testing available in multiple sites. I heard about a site this morning, for example, at Kennesaw State University. Mm-hmm. Many counties are doing testing. Fulton County Department of Health has offered many testing sites that are not in the health department, again, for people to be tested. CVS has testing available. So there's more testing. We need more, but I think testing is being scaled up, and week to week, we're seeing more and more testing available. I think we're still at a point where testing is primarily available to those who are sick. And to really get to where we need to be, we need to make testing available to everybody, whether you're sick or not, because we know from a study worth mentioning, there was a study done in a nursing home in Washington State in which they tested 76 nursing home residents. And of those 76 residents, 23 were infected. And of those 23 that were infected, 10 had symptoms, but 13 did not have symptoms, and yet they were positive. So I think there's a lot of asymptomatic people or pre-symptomatic people out there that may be infected. And until we can test asymptomatic individuals, we have enough test capacity for that, we will not be where we need to be. As far as the antibody test, again, is being scaled out rapidly, is being done more effectively. We now have Emory has a test that has started to use, and it's beginning to roll out in an effective way. And there are many other tests available. At Grady, we're doing the test done by Abbott Laboratories, which is a very good test. And in fact, yesterday I had my antibody test done, and my antibody test was negative. So as somebody said to me, you were negative on the swab test and you were negative on the antibody test. That means you're practicing your social distancing and your PPE very well.
Yeah. Should we be social distancing and wearing masks and gloves until the numbers in Georgia decline over a 14-day period, or is that recommendation out of date? I see only about 50% of people where I live wearing either.
Well, I think wearing a mask is something that we all should be doing. And again, I go back to those asymptomatic individual, right? I wear
Right?
a mask not to protect me, but to protect others. If I happen to be infected and I happen to be in that asymptomatic phase, if I wear a mask, I protect you. And if you wear a mask, you protect me. And I think we need to understand that the reason to you wear a mask is to protect others. So if we care about others, if we care about our fellow citizens, we should be wearing a mask. This is an issue of compassion and caring. This is nothing more than that. And therefore, this is where public health and community come together. As members of a community, we should be wearing masks to protect others.
So this next question is slightly similar. It's longer, so bear with me. Given that 80% of our country has ignored the guidelines set forth by the President's Council, it seems to be futile to recommend to anyone besides the elderly and compromised to stay at home. Therefore, it seems like the primary defense against this virus would be physical distancing of 6 feet or more, with every single person wearing a mask outside their house unless they're by themselves. While I realize this might not be feasible, especially in a restaurant, how do you think this would affect the number of cases? If the number of transmissions would be considerably reduced, then why don't all states follow the guidelines of Maryland and mandate that everybody wear a mask when in public places when they are not alone?
I agree with that. I think everybody in public places should wear a mask when they're not alone. I do think that we need to continue practicing social distancing. And I agree. I'm very concerned as states have started to loosening restrictions and people are out there. That doesn't mean this is over. This is still here. And my concern is because people are not practicing social distancing, because people are saying, oh, this is over, because that's why they must loosen restrictions. Then we're going to see an increase in the number of infections and an increase in the number of deaths. And that, to me, is a part that I'm concerned about. I tell people, why do I want you to continue practicing social distance? Why do I want you to continue wearing a mask? Because I don't want to see you in the hospital.
Yeah. This question goes to the accuracy of Georgia numbers. GDPH shows numbers that are consistently lower than numbers being reported on the news. Why does this discrepancy exist, and where should we go for accurate information?
Well, I don't run the Georgia Department of Public Health website, so I can't tell you why their numbers show what they show. I can tell you, though, that their numbers show there's a little line that says 14 days, and I would just say that the data in the last 14 days is not accurate. So don't look at that data. In the last 14 days, that is not accurate data. Don't look at that because it looks like it's coming down. That's not accurate data. There's delay in reporting, so those 14 days should almost not be there. As far as where to get accurate data, there's a bunch of other sites. I don't have them off the top of my head, but I mean, there's Worldometers has pretty good data. The Hopkins site has pretty good data. The New York Times has excellent data. If you just go to the New York Times coronavirus and you go by state, they can give you rates. They can give you a lot of data. So there are plenty of places to get data.
Are you concerned about the reopening of the state and the possibility that people have a misperception about the need for continued physical distancing? Are hospitals anticipating and preparing for a spike in new cases and hospitalizations? And if that happens, when will that happen?
Well, again, I said I am concerned about restrictions being lifted, not because they're being lifted, but because people are interpreting this as it's over. If restrictions were lifted, but people would continue practicing social distancing, would continue wearing their masks, et cetera, washing their hands, I think we would be okay. But the problem is they're not. So that's one thing. On the opposite end of the spectrum, I worry that, yes, what we're going to see is we're going to see our hospitals overtaken. We're going to see an increased number of hospitalizations, and we're going to see our hospitals overwhelmed, which, to be honest with you, up to now, they have not been. And that, to me, is a big concern because we've been able to take very good care of people. We've been able to have excellent survival across Metro Atlanta in our hospitals because we have not been overwhelmed. That's been very different in places where the hospitals have been overwhelmed. So the last thing I want to see is hospitals overwhelmed. And when will that happen? Well, I think it could happen, in 2 weeks and 3 weeks. It's hard to know. It's hard to predict.
It has been reported that treating COVID-19 with hydroxychloroquine and a Z-Pak has had seemingly amazing results. There have been informal documented results of thousands of patients being treated with upwards of 90+% success in reducing the duration and severity of COVID-19. In your expert opinion, why is there so much distaste for utilizing this treatment among American physicians?
Well, there are a couple of things. I think a lot of those reports are not necessarily well-conducted study. They're anecdotes. And we as Americans and we as scientists do not like to treat people based on anecdotes. We'd like to treat people based on facts. And well-conducted, randomized, double-blind studies are currently being conducted in the United States that are going to answer the question of hydroxychloroquine. Does it make a difference, yes or no? Does it make a difference with a citro, yes or no? None of the studies conducted today is a study of enough quality to say this makes a difference. And I'll say the same thing about remdesivir. There were plenty of studies in remdesivir that were anecdotal that show no benefit until a well-done study showed benefit. So let's wait for good studies to be conducted. I'm not going to say it doesn't work, but I want to see data.
If a company requires someone to return to work in the office, what would you recommend an employee ensure their company is doing to protect their safety while they're there?
Well, I've been talking to a lot of employees, and depends what your business is, and depends what you do. And I think if you're a law firm, it's very different than if you're a retail, company. If you are a Starbucks, for example, I think you need to think about two things: the safety of your employees and the safety of your clients. And as much as possible, you need to ensure that your employees and your clients are safe, and therefore, doing things like hand washing, like face masking, like hygiene are going to be very important. But the other thing is you need to put in place human resource policies that allow people to be open about what they're doing and their communication. In other words, if I don't feel well today, if I should be able to call and say, I'm not going to go in because I need to go get tested because I think I may have this. So we need to also ensure access to testing for our employees so people can actually not come to work sick, get tested. Because the key to controlling a pandemic where we are right now, the key to be safe where we are right now is through testing, which is, identification, through isolation. You take those infected and you isolate them, and then through something called contact tracing. And contact tracing means if I'm found to be infected today, somebody talks to me and says, who have you been in contact with in the last week? And then they get in touch with those people. They go reach out to them and they get those people to be tested to find out that, and if you're able to do that, then you stop the spread of an infection, because then if I infected you and you get isolated, you didn't pass to somebody else and you don't continue passing to somebody else. So contact tracing is critically important in stopping the spread of this infection. Testing, isolation, and contact tracing are the key strategies to stop the spread of infection at this point in time.
My understanding is COVID cases have gone down a little. If so, could you speak to that? I'm curious how close we were to the 14-day threshold that was originally mandated for moving to phases 1, 2, and 3.
As a nation, COVID cases are going down. But if you separate those into two groups, they're really going down in New York. They're going up in the rest of the country. So you cannot look at the entire United States, because New York had a very different epidemic and has been doing very different things. I think about New York as another country, really, and separated from the rest of the U.S. And if you look at the rest of the U.S. outside New York, cases are actually going up.
How do you combat all the conspiracy theories that people seem so eager to believe?
It's very hard. And it's very hard because we live in this era of the internet, of social media, of very rapid communications. There's a lot of conspiracy theories. There's a lot of misinformation. And it's very unfortunate because for those of us working in public health, it really is very counterproductive to have misinformation out there, because then you cannot get your work done. I almost feel like you're in a boat and there's a hole in the boat and you're trying to get the water off, but as you're trying to bucket the water off, somebody's with a hose putting more water in. I mean, there's simply no way to stay ahead of the game. And the reality is that all of us in public health have the responsibility to counteract that false information and to clarify it for people. And people have the responsibility to look for the right information, to really follow credible sources.
I have friends say that we need to get out and expose ourselves a little bit in order to help our bodies build an immunity to the virus. Is that true?
Well, again, you can get exposed to the virus, and if you get exposed, you can get sick. And if you get sick, you know, 80% of those get sick are going to be fine and going to get a little sick, but not too sick. And the other 20% are going to get really sick. And even those that don't get terribly ill and still stay at home, I don't know if you've seen, Chris Cuomo got pretty sick and he was at home and he's feeling terrible. So it's not a mild illness. But let's assume you don't have the mild illness, you have the more severe illness, you get hypoxic, you end up in the hospital. You can end up in the ICU and you can end up in a ventilator and you can end up dead. So, I mean, it's a risk that you're taking. If you decide that's the way to want to go, you need to know the consequences. It's a little bit like saying, we all need to speed a little down the freeway because it's nice to feel the sense of speed, and we need to get our cars tested to see how fast they go. But you can have an accident and kill yourself. And I think more importantly, you can kill others, right? Because you get infected and you can infect others. So I would advise against getting infected. I don't think it's a good strategy, and I think it's a very dangerous strategy.
Will Georgia hospitals be getting remdesivir?
We're in the process of trying to talk. What happened is the remdesivir, whatever remdesivir was at Gilead, was given to a corporation by the federal government. And that company is currently in the process of distributing remdesivir. And they're getting lists from hospitals. And as of yesterday, I don't know hospitals in Georgia. I haven't asked in Georgia. At least the Emory hospitals in Grady had not been added to the list, and we're in the process of understanding why. So no, I'm concerned about two things. Number one is transparency in how remdesivir is being distributed, and number two is equity. Right? Is the remdesivir being given to the hospitals that have cases as opposed to just to whomever? Initially, I thought my understanding was that number of ICU beds and number of cases was going to be the driver, but that appears not to be the case.
Have you been getting out yourself?
I get out every day because I go to the hospital. I go to work. So I get up early in the morning. I get in my car. I go to the hospital. I wear a mask. I'm going up and down the hospital. I have meetings. I go to floors. I talk to people. And I come home 7 or 8 o'clock at night. If I come home early, like yesterday, I got home around 6, I go out for a walk. So I am getting out, but I'm getting out carefully, and I'm getting out wearing a mask. And as I said, I haven't gotten infected, so I must be doing something right.
Are symptomatic people more contagious for COVID than asymptomatic people, or is the level of contagion the same?
The level of contagion is the same, but the level of contagion actually varies by the stage of illness. So people that have been recently infected are actually more contagious than people that are later in their course of illness. So in fact, somebody who's asymptomatic or pre-symptomatic right before they develop symptoms in the early days of infection is really infectious.
Diarrhea, why aren't we tracking rate of recovery?
I'm sorry, what was the question?
Why aren't we tracking the rate of recovery?
What do you mean by the rate of recovery? I'm not understanding what the question is.
I'm guessing this person means the number of people who recover from it. Is that our 80% number that we talked about? That's the rate of recovery?
It's being tracked. If you go to most websites, it actually says recovered X number. Deaths and recovered are being tracked.
Should beach vacations scheduled for June, July canceled? Is it safe to stay in hotels or condos? Cleaning, distancing, and other guidelines are followed.
I think if cleaning and distancing and other guidelines are followed, go to the beach. I don't see a problem why. I think it may be actually a fairly safe place to be out there. Just don't go to the beach with hundreds of people, right? We've seen pictures of beaches that scare me. But if I can keep, I saw also a picture of somebody who on a beach had an umbrella and had drawn a 6-foot circle around them. If you're able to keep that social distancing, is great.
It's been 4 weeks since a first positive test, 3 subsequent tests still positive, no symptoms. Can you explain?
Yeah, it's something really interesting with this virus that some people may shed virus for quite some time, and we don't know why. eventually you will clear the virus. But no, we're still in our infancy in understanding what is the case. So can I explain it? No, I can't explain it. I can tell you it's a reality. It doesn't happen to everybody, but there are some individuals who for long periods of time shed virus.
People are interested in data, Dr. Del Rio. The question is, do you get takeout yourself?
I get takeout all the time. I already ordered takeout for tonight.
Okay, good to know. Which lessons learned from the HIV/AIDS epidemic could help improve the public health response?
And again, going to takeout, I think a lot of restaurants have become incredibly innovative. I mean, this place I ordered takeout from today, I called, I gave my credit card number, and when they even asked me what kind of car I have, what time I'm going. When I show up, I open my trunk, they put stuff in there. I don't even see who the person is putting stuff in my car, and I leave. And then, they put it in such a way that I can get home, take it out, clean it, and as I said, I've not gotten infected. So obviously they're doing it right and I'm doing it right. The lessons from the HIV epidemic, I think there are many lessons. Number one is the fear that happens, right? I remember the early years of HIV, there was a lot of fear, and I think we're seeing fear. And as a result of fear, we're seeing stigma, we're seeing discrimination for people, whether you're Chinese, whether you're, in the area of HIV, it was against, homosexuals. And so we're seeing clearly, remember the early years of HIV, they talked about the 4 H's of HIV. So I think stigma is an issue. I think, but I'm also seeing how the important lesson from HIV, there are 3 things that are important lessons. Number one is the role of community. We're not going to be able to control this epidemic without the community being engaged. And you mention it right now, right? If the community doesn't wear a mask, we're not going to make it happen. So community is very important. The community needs to really buy into doing the right thing and getting it over. Number 2 is the role of government, scientists, and industry working together. And I think the remdesivir trial is a great example of government, industry, and scientists working together. And that's how we advance therapies. That's how we get to treatments that work. And the third lesson is about the importance of discovery and about how discoveries that we made in HIV are helping us. And I'll give you an example of that. Because of what we did in HIV and how we developed testing in HIV, and now how we do viral load testing for HIV, we have the platform of testing laboratories that is now allowing us to test for COVID. If we hadn't done all that discovery and testing around HIV, we would have never been able to do the kind of testing we're doing for COVID. So discovery in one area impacts another. And what I'm saying with that is a lot of the science and discovery that is happening around COVID may actually benefit in other diseases.
Do you see COVID-19 coming back in the fall?
I first want to see it go away. It hasn't gone away. So why is it? I mean, this is a little bit like having a neighbor in your house. Let's say your in-laws are in your house, and they haven't left, and somebody says, "Are you afraid of them coming back?" Well, I first want to see them go. Right? We haven't seen this virus go anywhere, so I'm not going to worry about coming back. I'm worried about the virus persisting here, not leaving.
Yeah. The antibody tests seem really unreliable. Would you recommend them?
The problem with the antibody tests is they're all over the place. There's some good ones, there's some not very good ones. It's the wild, wild west. So are there ones I recommend? Yes. Are there ones that I wouldn't recommend? Yes. You need to really look at the reliable ones. Some of them are really good, and actually, that the validation that has been done shows very good results.
Is it safe to begin slowly open personal quarantine bubbles from those you live with to include close friends and small gatherings?
I was talking to somebody the other day who said they have small gatherings with friends with another couple, and they do it in their deck, and they do it social distance, and I think that's fine. I think we need to think about how, again, physical distance should not mean social distance, right? We need to continue practicing a certain degree of physical distance, but that doesn't mean we shouldn't be able to socially get together with people in ways that make sense and are safe.
I'm going to make this one of our last questions. Do you think that the newly FDA emergency approved 1-hour CRISPR COVID-19 test, especially for us in Georgia. Can you
Well,
tell me what that test is?
it's a
Dr.
very
Del Rio, tell us.
it's a very quick test that can allow you to get a result. Again, there are a lot of tests happening, but still, I still think that the tests we have today are not necessarily tests we're going to have in a few months. Testing is advancing rapidly into better tests, into more rapidly performed tests, and into tests that actually are incredibly reliable. So I think testing is advancing, and yes, the more testing we have, the better it is.
I'd like to end, if you don't mind, by you giving us your best advice for the next week ahead until we check back in with you. Obviously,
Well,
we're going into the next week of being open in the state, and your best advice.
So I think as things are opening, I think all my advice would be that people need to use caution, need to exercise caution, need to exercise. This is not time to say it's over. I mean, this is a little bit like, I get in my car and I put my seatbelt. Exercising caution is good for you. And I think it's very important that people think about this. What am I going to do? How am I going to do it? How can I continue practicing social distancing? How should I wear a mask all the time? How should I, when I'm in public with other people, washing my hands? I mean, make it a priority not to get infected. The reality is you don't want to get infected because getting infected may land you in the hospital and may actually make you lose your life. So do not get infected. Do whatever you can. And the other thing is to think about vulnerable populations. And in that respect, I think about elderly populations. A lot of the deaths we've seen are in people that live in nursing homes, people that are older. We need to take care of our elders, but we need to take care of our elders by not letting them get infected, but at the same time making sure they don't feel separated, right? How do we continue? I've been, for example, with my in-laws, we taught them how to do FaceTime, and now we can FaceTime with them, and they are incredibly happy and connected. We can't see them, but we can FaceTime. So figure out ways that you can actually connect with people in ways that you didn't do it before, but make sure you keep those social connections, because the only way we're going to get over this is if we all work together in a very effective way.
I have a question for you. There was a lot of video online this week, crowds hanging out in Atlanta, not socially distancing, not wearing masks. When you see video of that, of these large groups of people, what goes through your mind?
Well, what goes through my mind is just a sense of a combination of anger, anxiety, and depression, because we have gone very far. We have already, despite everything we've done, we have an enormous amounts of deaths. And I worry that people are not taking it seriously. And I worry about what could happen and what the consequences are. The sooner we do the right thing, the sooner we would be over this. But it seems like we are choosing to ignore it and then confront the reality. And the reality is one that you don't want to see. I mean, I think everybody has seen, as I tell people, I don't want to be in New York. People have seen what happened in New York. I talk to my colleagues in New York. It's an absolute disaster. I don't want to see that. So I want people to really be responsible. I mean, that's all I have to say. If we cannot be responsible, I think we are doomed, because then there's nothing we can do to end this epidemic.
Thank you, Dr. Del Rio. We always appreciate your
Good seeing you.
expert advice and counsel. Good to see you too. We'll see you next week
We'll
for
talk
our
next
next
week.
check-in, our next round of questions. Thank you so
Okay.
much.
Take care. Bye-bye.
Everyone be well. See you soon. Bye.